Unvaccinated people threaten the safety of vaccinated people even with high levels of immunization against COVID-19, according to a new study published in Canadian Medical Association Journal, CMAJ, countering a popular narrative that vaccination is a matter of individual choice and suppose. While the risks of foregoing vaccination are greatest for the unvaccinated, they are more likely to be infected, hospitalized and die from COVID-19 than vaccinated people. The findings tend a commonly used argument that it is the refuser alone who bears the consequences of this decision. Given the disproportionate levels of risk the unvaccinated pose to the vaccinated, vaccination cannot be framed as an entirely self-regarding choice, explained study author Dr. David Fisman, a professor of epidemiology at the University of Toronto. In light of this, Fisman said policies like vaccine mandates or vaccine passports that restrict access to non-essential services such as restaurant dining or public transport seem reasonable. Such policies are also in line with other regulations designed to protect public health, he said, pointing. There is a strong history of law and policy supporting vaccine mandates for the sake of public health in the U.S. as well, with a Supreme Court precedent favoring mandatory smallpox vaccination dating back over 100 years. Vaccinated individuals have a right not to have their efforts to protect The paper does not capture another series of health risks the unvaccinated impose upon the vaccinated, Fisman said. As the unvaccinated are more likely to end up in hospital with COVID-19, Fisman said they take up more resources and deprive the vaccinated of access to care for other conditions such as cancer or heart disease. By the numbers, who's refusing COVID vaccinations, and why, Forbes unvaccinated more likely to get long COVID, and suffer symptoms for longer, studies find. Forbes full coverage and live updates on the coronavirus.